This is something that this measure was passed over 40 years ago, has been funded by Democrats and Republicans. We've had to take $1.6 billion out of the budget. Never would even consider coming near this budget line, and it needs to. We're hopeful that the House will restore this needed health care coverage for these folks, and if not, we'll do everything we can to get it restored in the Senate.
They prioritize just like you do. They want higher education, and I mean, this is just a way of putting that back in.
As I said in my comments today, I haven't had one college president come to me and say, give me money from the money that pays for health care for needy blind people. Whether you do or not, I mean, this is a value in our state, one we've supported these people. You know, we've talked to folks that have been on this program for 2 decades, that rely on it to get their medicine, that rely on them to be able to live their lifestyle so that they can go to work and be productive citizens of our state, and to rip that safety net out from underneath them is just dead wrong.
Governor, if it comes down to obviously matter priorities, but if programs like this aren't what should be cut, how would you prioritize what needs to be cut as the legislative session wraps up?
I mean, I laid out my budget at the beginning of this year. I mean, I spent a better part of 3 months putting that process together, laid out that budget in a very clear fashion, in a complete document. And in that, obviously, we had to make some choices. We put some additional money in for K through 12. We had to kick down some Medicaid rates to get dollars saved on that side. We had to obviously trim some of the higher ed, but we've been able to put $40 million back there. The bottom line is my budget, as presented with the changes I've made, I think reflects Missouri and reflects the best way as a path forward for our state.
Trying not to think about the implications too much, because it is really scary. If that happens, it's going to be very difficult to keep staying in decent health and to figure out how I'm going to get my prescriptions, to be able to ever go to the dentist, to do all kinds of things. The blind actually are, for lack of a better term, the worst off of any other group. We have a 70% unemployment rate. And while the national unemployment rate of 9% certainly ain't great, I mean, 70%, I mean, that's pretty extreme.